Hello everyone. It is me, Dr. Toomer, for Dr. Toomer Talks on Tuesdays. So, thank you all for listening in. If this is your first time, please say hello and that tell us that you're here. And if you're listening to this later, just put in hashtag replay so you know you've come and visited. And so, one of the things I'd like to do now is let you know that Dr. Wada is here with me today. She is an allergist and immunologist. She also does lifestyle medicine. And I'm going to let her introduce herself because she does quite a few things. And I'm just hoping that uh, I know it's going to resonate with a lot of people because people come to me and she's quite an expert on inflammation. And that's what
Mm.
we're going to talk about. So thank you for joining me today.
Thank you so much for this opportunity. And I'm so pleased to be able to chat with you and in your community this evening. So, yeah, I have some experience with inflammation, both personally and professionally. So, I am internal medicine and pediatrics trained, and then did fellowship in allergy and in immunology. It's one of the few specialties where you get to see patients from across the lifespan and really kind of take care of them in a very holistic way. So those are some things that really drew me to the field. But about 2 years into my first big girl job, out of training, I was just back from maternity leave after having my second of my three kiddos. I was incredibly tired. I hurt and a lot of back stiffness um, that oddly enough always went away when I was pregnant during my two pregnancies, but came
Hmm.
roaring back afterwards. And that seemed kind of odd because most of my girlfriends were having more back pain with pregnancy, not
Mhm.
less. And I went to get my dental checkup, and my hygienist said, "Hey, Kara, your mouth tissues, they look really dry." And that was kind of the last straw to really say, oh yeah, and I have dealt with dry eye to the point where I couldn't wear contacts or really tolerate wearing mascara. I'd look
Mhm.
like a raccoon. And had some other kind of quirks on my labs and things over the years that it's like, oh, okay, with kind of the clinical background I had. And I was like, I'm worried about something called Sjogren's, which is an autoimmune condition. Really, all I learned about it in my training was woman, dryness. And then
Mhm.
for the pediatric boards, you needed to know that it can affect a baby if a woman with Sjogren's is pregnant.
Okay.
And what I realized, in the subsequent months and years after my diagnosis is that, dryness was kind of some of the last of my symptoms. I had many other symptoms that emerged prior, and kind of along with that, fatigue, the back stiffness and body pain, probably similar to fibromyalgia, is what I think it commonly is mistaken for, and some issues with my nervous system. So when I would try to scrub in on my OBGYN rotations in the really warm operating room, they kept the operating rooms warmer for the
Yeah.
babies being born. I would always have to scrub out because I would
Mhm.
feel like I was going to faint. And
Wow.
so it turns out that Sjogren's is also associated with a lot of small fiber neuropathy and problems with the autonomic nervous system. So things like POTS or orthostasis, where you change position or you stand too long and you feel like, or you actually pass out. And so really it was kind of that diagnosis and being pretty burnt out professionally that kind of recalibrated and found lifestyle medicine and coaching, and realized if I had so much trouble figuring out what the heck was going on with me, navigating the healthcare system, figuring out what to do from a lifestyle standpoint, like what was up and what was down, what was reality and
Mhm.
what was the sales pitch. I said, goodness, what's that mean for everyone else? And
Yeah.
so that's really where all this other work has really stemmed out of.
Oh, wow. That, yeah. I hear that quite a bit with, especially with physicians who shift at some point in their career. Those of you who know me know I did the same. Um, and so, before we continue, though, I do want to say hello to Chris, who comes every single week, and I
Hi,
just want to say
Chris.
hello from YouTube, and my aunt Cynthia, who also listens in. I really appreciate your support. And so, and if anyone else is watching, just say hello so we can say hello back. So I have a question because many of the people watching, and many of are not medically trained. So when we talk about inflammation, what does that actually
Mm.
mean?
Yeah, so inflammation has become this really popular word, kind of the new boogeyman, right? It's kind of scary, but inflammation actually is, when harnessed correctly, is our body's system that helps us fight off and fix infection
Mhm.
problems and help heal from injury.
Okay.
The problem is when we see too much of it or it sticks around for too long. It's like a house guest that has like well outstayed their welcome. And what we've noticed is that if you look across virtually all of the diseases we see in kind of modern living, allergies, autoimmunity, problems with dysmetabolism, diabetes, cancers, heart disease, they all stem back to an excess of inflammation or too much inflammation.
And so when you say inflammation,
Mhm.
um, what are some of the symptoms though when people know that their inflammation is kind of gone beyond what is considered normal?
Yeah. So when we typically, are teaching inflammation for the first time to our medical students, we go back to the Latin, but to translate it, it's red, it's swollen, it's hot, it's painful, and usually it's throbbing.
Mhm.
And so those are the things we think of with acute or, quick onset inflammation. When inflammation's chronic, it can look different depending on what part of the body it's affecting. So if I'm taking care of someone with chronic nose and sinus inflammation, a lot of times they're going to have trouble with nasal congestion, too much mucus or, snot production, feeling like they have it dripping down the back of their throat, having to clear their throat, coughing. In the case of asthma, maybe wheezing or coughing or trouble just feeling short of breath. And when it's our joints, it can feel like stiffness, can show up as swelling many times. And sometimes we may not notice it as easily. So, with heart disease, for instance, a lot of times it can kind of be a little bit more, insidious, kind of sneak up on us over the years.
So one of the things that I encounter quite a bit, particularly when people come to me for weight loss, is they're always concerned about their joints, mostly the joint pain.
Yeah.
And then it's usually concerned about whether they have um, arthritis and different types of
Hmm.
arthritis. So
Hmm.
when you encounter that type of inflammation, does weight loss really help with that, or does there something else that people have to do?
Yeah, so it does go back to, the underlying type of inflammation can be really helpful to know. If someone has an inflammatory arthritis, like
Mhm.
rheumatoid arthritis, it's really
Yeah,
important to, to work on getting that inflammation controlled so that you don't end up with permanent joint
yeah.
damage. Um, but we know that even a modest amount of weight loss, 5% of body weight, can really move the dial when we look at systemic inflammation levels and really bring those down. And it's not uncommon for me to hear that folks are like, oh goodness, I feel so much better. It's almost like the clouds, clear, the fog lifts. um, that really can make a significant difference. With and I think what I hear sometimes
Mhm.
is folks will see, whatever number they're at, and they'll focus on the number of like getting to whatever maybe that goal weight was
Yeah.
from years ago. And I say, no, 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 no. Let's focus on small, sustainable changes that you're going to be able to maintain because they really do make a huge difference.
I'm glad you said that. So those of you who work with me and who didn't hear it just from me, I'm often say that I, I I help people lose weight, and I often say I really
Yeah.
don't care about the number on the scale. I often actually meet with people and never even ask them how much weight they've lost. It's usually how you feel that's more
Yeah.
important because that's ultimately a better gauge of how healthy you
Mhm.
are than a number on a scale.
Yeah, we've been so indoctrinated with diet culture. And
Mhm.
And even a lot of what I see in kind of wellness is just diet culture gift wrapped
Yes,
with a bow.
exactly. And that's actually brings me to my next question, because one of the things that I talk a lot about is carbohydrate management, which
Hmm.
not elimination. You
Hmm.
all hear me say this. I just
Hmm.
really it's more about protein management to help counter
Yeah,
carbohydrate management. So when you also talked about diet, and lifestyle, we know that life part of lifestyle is diet and eating. Is there a strong connection between what people eat and their inflammation?
there is. Even, dating back to before I even dove headfirst into all of this, one of the first things I did as an attending was present a journal article for our allergy association. And it was looking at the dietary inflammatory index and its relationship to asthma control. And we know that people who eat a more anti inflammatory diet, so a diet more consistent with the Mediterranean kind of diet,
Mhm.
as opposed to that sad standard American diet, have better asthma control when you account for, other measures. We also will see that in other autoimmune and inflammatory diseases too. So I'm a big fan of recommending that people eat a wide variety of things, especially plants, and then work on trying to minimize the refined carbohydrates, opting for whole grains, um, the starchy roots. We talk sometimes about increasing the resistance of starch by meal prepping, so cooking some things ahead, letting it cool down, and then reheating it. I'm a big fan of that. I'm a mom of 3 little kids, so planning ahead is really critical. And then one of the things that, working with a dietitian, she helped me realize I was not getting enough protein, especially
Mhm.
early in the day. And when I would eat a real carb heavy breakfast, even if I was eating oatmeal, something, generally quite nutritious, I was getting this big energy slump after lunch. And she said, hey, if you increase your protein to, and gave me the calculations based on my height and my weight, I think you're going to do a lot better. And sure enough, when I, kind of follow, closer to that formula, I'm able to get through clinic. My energy stays, in a happy place. I'm not reaching for kind of those foods that my lizard brain is craving.
Well, before we continue, I just want to say hi to Caesar Cervantes, who said,
Hi.
"Hello, hey superstars."
Oh, one of my favorite
I
people.
know, mine too. So that's why I wanted to say hi. Um, and so when you say Mediterranean diet, what does that actually
Yeah.
mean?
It doesn't mean you have to eat everything from Italy and Greece. So really it's a foundation of building your diet primarily around whole foods, things that aren't, super processed and packaged ideally,
Mhm.
aiming for a wide variety of vegetables, fruits, nuts, seeds, beans, huge in kind of Mediterranean style of cooking. Did I say whole grains? Not sure.
Yes, you did.
And minimizing, in particular the saturated fats like red meats, fried foods, those sorts of things. And it can take shape of all the different cuisines.
Mhm.
We are in a biracial household. My husband's Asian American, so we're eating a lot of Japanese American and Japanese inspired foods, and making that work in that way too.
And so you hear a lot about olive oil as well,
Yeah,
and
oh, so
using
good.
it
Healthy
as a
fats.
basis
Yes,
for
thank you.
something in
Yeah.
avocado oils, and everyone's using those
Yes.
quite a bit. So if someone is at what point should someone be concerned about
Mm.
having uncontrolled or chronic inflammation? Um, what should they who should they go and see
Mm.
first? Who
First and
should they
foremost, they need to go see their primary care doctor, their family doc,
Yeah.
their internist, if they're still a kid, a pediatrician,
Yeah.
or their family doc, of course. It's
Mhm.
so critical. If we could have, goodness, if we could have meaningful relationships with our primary care docs,
Mhm.
that would that would fix a lot of things. You know, if we could really switch up the healthcare model. So I think that's first and foremost, getting kind of a really good check under the hood. Someone to, you know, look in your nose, your ears, listen to your heart, your lungs, feel in your belly, ask you, you know, kind of those head to toe questions we call the review systems.
Okay.
Really important. The other thing that, you know, is helpful to consider, you could ask, you know, hey, am I due for some blood work? Could we check and make sure that my liver function, my kidney function, my blood counts look okay? Maybe think about checking something like a SED rate or CRP. Those are inflammation markers. They're not specific, but if they're elevated, they may give you a clue to say, yeah, maybe there is something going on. And then the reality is, with how our healthcare system works, if there's a particular organ system that seems to be, you know, shouting at you a little bit more, then you may end up seeing a specialist from that area.
Okay. And at what point then, if so, as a primary care doctor, I can tell you, I actually appreciate it when people come to me and ask me for specific labs. And so you mentioned CRP.
Yeah.
And so if you can just tell us what those are and what they should ask for, or what is probably excessive in an initial assessment.
I think it's going to vary based on person to person. So CRP is a C-reactive protein. It's a protein that is primarily produced in our liver, but that will become elevated in various kind of inflammatory states. It can be falsely elevated occasionally, especially if you have an infection. And so, you know, you would want to maybe try to get labs drawn when you're in a usual kind of state of health, not, you know, just getting over COVID or something like that. But it is elevated, or when it is elevated, it is kind of something to be mindful of and to be conscientious of, because there are, you know, some data to link long-term elevation to heart disease and other issues. ESR, or also known as SED rate, is a similar marker. It just sticks around a little bit longer. So similar labs looking slightly different ways. You know, some other things that you may consider if your joints are bothering you, and especially if the story about your joints fits, you're having more stiffness, especially in the morning, it's lasting more than 30 to 60 minutes, then your doc may consider ordering some what are called autoimmune labs, where there are particular antibodies or proteins our immune system can create that essentially would tell us that your body is no longer seeing yourself as safe or tolerating it, that maybe now it's viewing it as a problem.
Well, thank you for that. I'm in for anyone who works with me and who knows me, I'm asking questions for you to to reinforce a lot of what I say, so that people don't just hear it from me. And so, how does stress play into inflammation?
Can very easily turn the dial up. You know, and I say that with a little bit of hesitation or a disclaimer. Okay. For so long, stress, hormones, weight, or gender have been weaponized, in particular against women patients and other marginalized communities.
Yes.
And then magnifying it. But we do have really solid science to say that when the body is under stress, if someone is subject to trauma, even trauma early in childhood, adverse childhood events, that increases the risk of developing a chronic inflammatory disease and just turns up the dial. I know personally, learning to better manage my stress, I'm still human. I still stress, you know, life is stressful, but having a better tools in my toolbox to manage that has really helped when it comes to my own pain, my own energy level, you know, the symptoms that I attribute to my autoimmune condition.
Okay.
Yeah.
So before we go, I'd like to know, so you mentioned that you're a allergist and immunologist. So I'm assuming
Mhm.
that that would be more local for
Oh
helping
yeah,
with that.
yeah, yeah. So
So
I
then when it
see.
comes to your
Yeah,
lifestyle
yeah,
medicine and
yeah,
with your life coaching,
yeah.
is that also local, or is there people from other places that could contact you if they want
Yeah.
assistance?
So I have a clinical practice where I see and treat patients medically at the Ohio State University. I also have a coaching program that I co-run with a dietitian that helps me, Jennifer. So we run that. That is global. That does not provide medical care though, so we have to kind of have a little bit of a distinction there.
Yeah.
Um, and yeah, and that is all done virtually.
Okay.
Yeah.
Well, I'd like to, so you had mentioned that if someone wanted to find you, that they could
Oh,
find you on your
yeah.
website.
Yes, that would be great. And we have a really cool event kicking off about 6 days from today. It's the Demystifying Inflammation Summit. So, this is a free 3 day event really geared for moms and families who are struggling with too much inflammation. Their allergies used to be a sometimes problem. Now they're an all the time problem. Their joints are yelling at them. Digestion is just not what it used to be. We're going to kind of address things from head to toe. Day one, focusing on the science. Day two, on healthy habits
Nice.
that have science behind them, and then really putting it all together on day three, knowing that we are really smart. We know what we're supposed to do, but implementing it is really hard. So learning how to really harness the power of our beautiful brains.
Wonderful. Wonderful. Well, thank you
Yeah.
so much. And so if we
Thank
go to your
you.
website, we can sign up also for the summit.
Yeah, it's right up at the top. You'll just click the banner and your first name and email, and you'll be all set to go.
All right. Well, thank you so much for joining me and for
Oh,
coming
it's
on
my
and sharing your
pleasure.
knowledge and information. It has really been helpful. And I'll be signing up for your summit. And
That
actually,
would
I have
be
some
great.
family members I'll recommend signing up for
Oh,
it. So I'm
thank
assuming
you.
it's not for physicians, for anyone who has.
No, it's for anyone. Although for healthcare providers, kind of
Mhm.
across the board, we do have an option for CME. So really
Okay.
excited to make that available as well.
All right. Well, thank
Yeah.
you again for coming on, and
Thank you.
it was great having you. I'm
Oh,
so
it was
glad
a
we finally got
pleasure.
a
I
chance to
we
interact.
have to make sure to get you involved for next year's summit. That'll
All right.
be
I
really
would love that.
fantastic.
I would love that. Well, thank you
Yeah.
all for joining in, and good night, and we'll see you again next week on
Take
Tuesday.
care.
Bye.